It has been a smooth operation. I mean, we're not here to distract any proceedings of the schools. We understand that matriculants are writing their exams, and that's the same reason why it's not a march. It's us just distributing the letters, making sure that they follow the laws, because the Bill Act does say that when they're admitting foreigners, they need to have specific documents, and we'd like for them to abide by those laws.
Come next year, the schools or the department does not adhere to these laws. What's going to happen? What are you planning to do as Operation Dudula? Because we heard Steve Mabona say that we don't look at anything else but the child. We don't look at the nationality of the child. So what's going to happen if basically these requirements are not met?
So like I said earlier, that we will be stationed at the schools, especially on the first days of the schools, because we know that parents will be accompanying their children, and the same scenario that's been happening in the healthcare facilities will be applied at the schools, because that's the only way we can make sure that we don't have foreign kids in our public schools. Here we're talking about prioritizing South Africans more than anything. We can't have a South African child without a desk, yet we have a foreign child that has a desk. I mean, in one of the schools that we went to, the principal was open enough to tell us that she has 300 illegal foreigners in that particular school. Now, the law enforcers are also complaining that these illegal foreigners have a strategy that when they need to be arrested, they quickly grab a child, and then they're supposed to stop acting and doing the arrest and all that. So these are the challenges that our communities are being faced with, and it needs to stop. I mean, the influx of foreigners in this country is a big issue, and we would like for the president to stop actually putting bad names on us, but deal with this crisis, because it's affecting everyone. People are directly affected by this, and indirectly. You're looking at healthcare facilities, in education, crimes. I mean, how many kids are taking powder, and we all know that these crimes, we can link it to a specific nation. So, but our mandate for today will continue. I mean, we at the 4th school, we need to cover all 11 schools here in Ward 29, because this ward we are contesting for the by-election. And I'm going to plead with the media that when you do these reportings, can we do proper reporting? Because what transpired in Alexander, when the mother of the deceased was interviewed, the lady did not say anything about Operation Dudula, but kept saying parties with green t-shirt. But 405 went to go and say that it is Operation Dudula, when the mother did not even say that. So can we do proper reporting? Let's report real things to the people and not be biased. Let's talk about the real issues. That's my plea.
On the Alexander issue, I know you can't say too much, but are the operations at healthcare facilities going to continue despite this pending legal matter?
Operations are continuing across the country. We're not going to stop until we see enforcers and immigration officers being stationed at those facilities, making sure that the people that are receiving these treatment are South Africans. Then we will stop. That's what we've been asking, that we've been undertaking these operations for the past 3 months. But we're not seeing anybody from the department to take, to do what they're supposed to be doing. I mean, when the patient is inside already, it's something else, because the health department tells us that they can't act when the patients are inside already. But stop them from the outside to say, go to a private healthcare facility, make sure you pay for the services that you're getting. If you're here in a public institution and there's a method that you can pay, that you can use for payments, then they must pay. But in clinics, local clinics, like I said before, there's nothing like that. So they must go to private doctors. I mean, I don't want to go, because I wanted to say something about the mother of the late child, but obviously I can't say that.
Yeah. So if I'm understanding you correctly, you're basically saying, from what we've seen in clinics, if this particular school, or the schools that you've gone to, do not adhere to these rules, you will remove a child from a seat and take them out because they don't have documentation or don't meet these requirements.
Now, we're not talking about removing. You see, that's another false reporting.
Yeah.
We've never been to a healthcare facility and remove somebody out of bed. We've never done so. So we would address the educators, the principals, like we are doing in the hospitals. At times we do go in and talk to the CEOs of the hospitals if we do find them, the managers of the hospital if we do find them. But we will not literally be grabbing children. I mean, we're talking about minors here, but we will make sure that there will be a way of us making sure that they are being removed from that desk and the South African will be then replace that particular child.
On another matter,
you've been applauded, especially at clinics.
Yeah.
You've been applauded, says well done, because now we see operations, locals now going to the clinics. Can you give us the successes since you started this operation in clinics? In clinics.
It's all over social media platform, even on your media mainstream. You find even, healthcare workers saying that, the burden is now, been taken off their shoulders because they too cannot, are not able. One healthcare professional needs to see about 60 or 100 patients per day. It's not normal. So they are now working as normal human beings. We've been hearing how the elders are now happy that they do not have to wake up 4 a.m. to go and to go and stand in long queues, only to be turned back home. Or when you are lucky, you are seen by a professional, but there is no medication. And what we've seen, especially in GP, there was a report that they normally order medication every week. But ever since we've been busy with these operations, I think they didn't order in the past 2 weeks, which the government still need to tell us how much did they save in the past 3 months ever since we've been doing these operations, because they have saved huge amounts of money because the medication is not stolen and being taken to the countries as businesses. So there is a huge success and South Africans are happy, and when South Africans are happy, we are happy because we are for South Africans and we want South Africans to be prioritized.